So you can bring your own nurse with you. What a great idea.
Yeah.
We're here with Debbie Johnston from Care Advantage, and that's got to be a huge advantage and makes the patient feel so much more comfortable knowing that they had their own nurse they brought with them.
It does. It gives the family a lot of satisfaction to know that their loved one's being taken care of at night when they go home and they can rest peacefully.
Let's talk about the fact that once they do go home, that there's somebody available 24/7 if you need to be.
Yes. We send nurses home all the time with people. In fact, I have 2 on with my dad that actually live in with him. And it gives me a lot of peace of mind because I know he's taken care of. And he has companionship, and it just works really well.
You were telling me that the nurses that you put with your dad, you kind of matched his personality with theirs, and there's some chemistry involved there to make sure that everybody kind of gets along together.
You're right. We work really hard to find the right nurse for the right patient. Because if it works for a long, long time. They actually become like family members.
If you could help in one more way and get people to get in touch with you, what would you tell them that is going to happen right after that?
Well, Bill, I would tell them to call us, and we will send a registered nurse out to do a full assessment, which is free, and they do a care plan, and they make recommendation of hours, services needed, etc. And it's really great for the family because so many families are going home so sick, and they don't know what to do when they get there.
Does that give them additional peace of mind knowing the path ahead of them?
Yes, it does, to know that there's a caregiver that will be there if they need them.
There are lots of ways you help the families, even in helping them with finding the kind of services they need outside of your services.
Yes, with reimbursement, we accept Medicaid, Medicare, and private insurance, and we totally evaluate exactly what each patient has and what they can get.
I know your team is not only great with the patients, but you're also involved in the community. Tell us a little bit about that.
We're really involved in the community. You name it, we do it. We're getting ready to do the MS Walk. We're involved in Big Brother, Big Sister, when they have the duck race. We're involved in just about every community event that's out there.
Got to be very proud of that. There's lots of charities that you do get involved with. Tell us a little bit about the peace of mind that you're so proud of, too, that you bring to the families.
You know, it's really, I live it myself with my dad. It's really great to know that he has a caregiver with him at all times. I used to really worry when he didn't, and now I know he's well taken care of, and everyone's working so hard that it's just a great peace of mind to know he has a nurse.
The nurses that you send to the homes and to the hospital, tell us about some of the things they tell you when they come back, some of their experiences, some of the positives they report back to you about.
The nurses?
Yeah, the relationship that your people have with the patients.
Like I said, they end up kind of being family members, and there's a lot of bonding and a closeness, and it's very sad when we lose a patient. The nurses get very emotionally attached, and they become a family member.
And they treat their patients like family members.
Yes, they do. It's awesome.
That's great.